Okay, well, let me go ahead and put it into our slideshow. Oh, and let me switch displays here. All right, there we go. All right, so now that you guys can see, we'll just go ahead and kind of jump in. So my name is Kaitlin Brown, and I am obviously a speech language pathologist. I do specialize in the area of AAC, and I have a lot of training and background in pediatric feeding and swallowing disorders as well. So that's kind of where I come from. I have worked in private practice and the schools for the past 8 years now. But I have been practicing for 10 years, and I did skilled nursing facility with adults first. So I work with Dynamic Therapy Associates, which I'll talk about when we get to financial disclosures. And I started with them in January working as an AAC specialist. I work specifically in self-contained classrooms in a school district. And so I have a wide variety of students. I have elementary, middle, and high school students, and I absolutely love it. It is such a wonderful change for me. It was a very good blessing. I also am an assistant professor and assistant practicum coordinator with Brescia University in their master's program for speech language pathology. And I serve on the admissions committee and the orientation committee for Brescia as well. I am serving this spring semester as an adjunct professor with Western Kentucky University, teaching their SLP in the schools course. And so far, I'm really enjoying it, but certainly stay plenty busy. And for fun, I like to teach continuing education courses in my different areas of expertise. So that's just a little bit about me, and we'll get started. So, of course, financial disclosures. I am working full-time with Dynamic Therapy Associates, and I am a half-time professor with Brescia and then an adjunct professor with Western Kentucky. And now I do have a couple poll questions that Jim is going to launch for us. I just want to ask you guys what your profession is. So I think I listed SLP, OT, AT specialist, other. And then I have a question about how many years you've been in the field, and then a question about AAC users. So
All right, we're at 80% participation in that
wow.
poll. I'll end that one.
So almost everybody SLPs. Awesome. And a pretty decent mix there of our years. Perfect. Nice. Okay, so it looks pretty heavy in anywhere from 0 to 15 students in terms of how many kiddos are on your caseload. So let's see here. What? Sorry. And now it doesn't want to go. There we go. All right. So I'm going to close out of those results and the chat, and we'll keep going. So I like to do that just so I kind of know, how to tailor my examples. So it's nice to know that, there's not a huge population there in terms of how many AAC users that you have. I personally have, I've got 43 students right now on my caseload, and 75% of them are AAC users, and more to come, we'll put it that way. So definitely just wanted to know about that, and we'll kind of go into, we'll go into the learning objectives. So of course, these are stated. I'm not going to read them to you, but it just kind of breaks down what we're going to be looking at today. Definitely looking at some of those indicators, looking at how to introduce when we're looking at students or children in those early years, and then how to increase that parent and teacher involvement. So this kind of just goes into our introduction, but I also want to start by saying that I have been doing a lot of research recently into the vast differences in an analytical or analytic language learner versus Gestalt language processor. And I do want to say most of this presentation is geared towards what we would think of as an analytic language processor or language learner. I would have loved to do Gestalt as well, but we only have 90 minutes. So, I had to kind of go one way or the other. But as a whole, a lot of the things that we're going to do in terms of what types of AAC devices are used, what kind of intervention models or methods we might use, they are similar. Of course, you're going to adjust the way that you present them based on their level of Gestalt or their level of functional language if they're an analytic language learner. But again, just wanted to kind of preface with that. So just a quick introduction, most of you already know, but this just kind of breaks down our low tech versus high tech AAC. So of course, our low tech, we're looking at those gestures, pictures. This could be switches, sign, modified sign, pointing, facial expressions, a pod book. And then of course, your high tech, you're looking more at those speech generating devices, your eye gaze devices. Those are those robust communication, computer, technologically driven devices, if you will. And then we're kind of just going into those early communication milestones. Again, I'm not going to read all of these to you, but just kind of touch on a refresher, right? So when we're looking at these milestones, we have 13 to 18 months, and I did the age ranges based on both ASHA and a couple of other, like Stanford was one of them, and goodness, I can't think of it right off the bat, but it's on the reference page where I pulled these milestones from and how the age group breakdown was. So this one just kind of starts at 13 months. So of course, from a year, birth to a year, you're looking at other milestones. But if you have questions about that, feel free to look it up on ASHA or any other area. Just don't go to the CDC since their guidelines are still in question. So with the 13 to 18 months, of course, at this point, they are following simple commands. They're starting to point. We're seeing some of those early pragmatic skills. So answering yes, no questions, making those requests. They're very good at imitation at this age. They understand those different words and use words for common objects, actions, familiar people. They're starting to point to body parts. They're making those funny faces, clapping their hands, giving high fives. And then we're starting to see a lot of combination of those word strings. So a lot of times you can't understand what they're saying, but they're telling you a whole story. And so it has that same inflection. And of course, they're actively acquiring those new words. Then from our 19 to 24 month stage, this is where we're using and understanding at least 50 words for various items. Of course, articulation is not going to be perfect by any means, but you'll likely hear a lot of errors at this point. You're typically seeing them put together 2 or more words into those simple phrases. A lot of times they love making those animal sounds, playing with the barn. They can follow those simple two-step directions or two-step commands, and they're starting to use some of those early possessives like mine, me, you, dad's shoes, things like that. They are definitely asking for help, and then using those 1 to 2 word questions. Okay. Then we have our early communication. So this is between 2 and 3 years. So of course, we're starting to see more word combinations, some repetitions. They're seeking that attention with the use of words expressively. They know their name, their age. They're at least able to give that to you either verbally or in gestures. So they may not be able to tell you that they're 2, but they can hold up their 2 fingers. They're using those plurals, using present progressive, and they're starting to use regular past tense verbs. They can give those logical reasons for things and events. They can ask simple questions using those negatives, starting to answer those early open-ended questions, what do you want to drink? And being able to say juice versus water. Then of course it has the breakdown kind of the articulation that we're seeing around this age. So one of the areas that I like to use, and this is kind of outside of AAC, but when we're looking at articulation, is using this, the 50% to unfamiliar listeners at age 2, 75% intelligible to familiar listeners, and then 75% to unfamiliar listeners at age 3, and 100% to familiar listeners. And this is from the ASHA norms. So with this one, a lot of times they are starting to use those different descriptive words, and they're understanding a lot of those spatial concepts. So that kind of pairs with being able to follow those different directions. You're starting to tell them to put their shoes in the bucket, or go get your milk and put it on the table, or the ball rolled under the table. They're starting to make those connections. And then we go into the 3 to 4 range. So of course, at this point, we're comparing things. They understand the different comparisons of like big and little, some of those different linguistic concepts that we think of. They're able to tell us a story either from a book or a movie, definitely understanding more of those prepositions and those spatial concepts, and they're starting to use them in their conversation as well. And using those articles, the a and the and phrases and sentences. One of my favorites, my son is 3. And so I'm seeing a lot of these things from him too. So like pretending to read, this is something he loves to do at nighttime. Like I'll read him a book and then he likes to read me a book. Of course, recognizing those signs and logos. So as you're driving down the street, they see a stop sign, they know, mommy, that means stop. Seeing different things out, like they see the McDonald's sign, they know that, oh, that's chicken nuggets and French fries. So making those associations. Pretending to write or spell. This is another one that's a favorite of mine with my son right now. He loves to pretend to spell different things, and he tells you very matter-of-factly too, like, no, mommy, this is how you spell cat. And I'm like, no, not quite. And then looking at that intelligibility, of course, we're looking at 100% by age 4 to both familiar and unfamiliar listeners. You're still going to hear some of those sound errors, like we know the R, the L, the TH. Some of those blends aren't quite perfect yet, but overall, you should be able to understand them as a whole, even with those errors that they may have. Categorizing, this is something that you start to see around this time, where they can both do the categorical naming, where they can, if you say, okay, what are 3 body parts? They can tell you 3 body parts, versus if you tell them ear, nose, eyes, what are all of those? And they can then pull out body parts. So then we're also, of course, looking at colors, being able to not only identify receptively, but expressively at this point. Being able to describe object functions. This is another one that we see a lot of and we use a lot. I've found myself realizing that when I do a lot of my open-ended questions with my students, that most of my questions revolve around object functions. So it kind of is twofold a lot of times. And then of course, regularly answering those WH questions and using multi-word sentences. Okay, then we go into 4 and 5. This is where we start to really see those grammatically correct sentences. A lot of them are much longer and more complex. They can include different parts of a story. So you're at this point, you're wanting to know, they can tell you who the characters are, kind of what happens, that plot, where it happens, different descriptors. We start to see irregular plurals pop up around now. Understanding and using those different location words, using those temporal words, following simple directions to play a game or rules in a game. This is always funny to me because, again, my son is starting to do a lot of these things, and following rules to play games is not always the best or what we want to do. But, like if he rolls the dice and it says no turn, he doesn't always want to do that. So recognizing and names 10 or more letters. Usually they can write their name at this point. Let's see. And then answering those why questions. This is one I can't wait to get to, being able to ask, why did you do that? That wasn't very nice. And him actually giving me a response, or why are you frustrated? And I feel like that's something, goodness, if all of our kids could tell us why they were frustrated, that would make life a lot easier for us, wouldn't it? If only. So, and then, like I said, now is where we kind of get into that categorical naming, and they can answer some of those short story questions. Some of that auditory comprehension is starting to develop around now. So I say all of that to get into, I want to pause real quick. Jim, I feel like I'm seeing a lot of chat questions pop up, and I just want to make sure there's nothing that I need to address right now.
No, some people were experiencing some sound issues, but it
Oh,
doesn't
okay.
seem to be universal.
Okay, good deal. Just wanted to make sure there wasn't anything I needed to address before we keep going. Perfect. So I did all of that to say that, sometimes it's nice to have a refresher. Some of those are a refresher for me, even actively working with kids on a regular basis, because as SLPs, we aren't always exposed to that natural language acquisition or what we consider typical language development, right? Most of the time we're coming in when there's some sort of delay or disorder or concern. So again, it's easy for me right now because I'm in the thick of it with my own son and my own children. But a lot of times I think we kind of forget that as SLPs. And it also depends on your setting. I have seen where, like, unfortunately, in early intervention, private practice world, I have seen a lot of times where parents will have almost these unrealistic expectations for their child, whether it be receptive, expressive, social, motor, whatever it might be. And it's not even that they're upset about it. It's almost just that they don't know these different milestones and what their child should be doing at different ages. In terms of, like, they want their child to answer a question, but they're 2 and they're presenting with a little bit of a language delay. We're probably not to that point yet. So a lot of times being able to break it down and kind of explain it to a parent, give them some of these resources, and depending on your parents too, you don't want them to follow this like it is, the end all be all, because as we know, as professionals, these are guides, these are milestones. This does not mean that if your child isn't doing any of these, well, if they're not doing any of these things, then yes, we need to be concerned. But if they're not doing everything on this list at this particular age, that doesn't mean that we need to, start to panic. It just means we need to start paying attention, maybe start doing some more intentional activities with them to target those different things. Doesn't even mean that we need to reach out to our pediatrician yet. But again, I feel like a lot of times parents just don't know what to do in those situations. And so I would much rather them go over the top and go to their pediatricians versus taking oh, they're fine, we'll wait and see approach, because we all know how wonderful the wait and see approach works out for our young children. And so that's kind of where that came from. And then, okay, this is kind of, again, brief overview and when to be concerned with our speech and language, right? So anytime that your child isn't meeting those age appropriate milestones, and again, like I said, if they're not meeting multiple aspects of those milestones. So if we're missing one thing or we haven't quite mastered one thing, that's okay. These are, like I said, these are guides. If you see that your child is unable to effectively communicate basic wants and needs, that's a huge one, right? And this is something to, whether you are in early intervention, private practice, the schools, this is going to lead to a lot of frustration for your parents, your children predominantly, and then your therapists, your teachers, whoever it might be. And that's where we start to see some of those negative behaviors will kind of come into play. And a lot of it is simply because they're frustrated because they can't communicate. So it's our jobs as clinicians to provide them with some means of communication, right? So then also looking at the different areas, I feel like SLPs do a great job of looking at the child as a whole. We're rarely ever just looking at expressive language. But our parents will tend to do this, right? Or even our teachers, where there's, they come to us and they're like, well, they're not talking. Okay. Well, tell me a little bit more. Are they engaged? Are they able to, interact with you? Is there some back and forth? Like, are they paying attention? Do they want to play with you? Are they interested in what you're talking about? And we're just seeing that expressive language delay, or are there other things that we need to be concerned about? Like, are we responding to our name? Are we, are we able to identify objects in pictures or even in our environment? Like if I show you a picture, or if I have a ball and a cup and I ask you, get the ball or show me the ball, or let's roll the ball, whatever it might be, and we're not getting anywhere, that might be cause for concern. Or, when you are playing with them, if they tend to prefer to play by themselves or different things like that, looking at that pragmatic side. And then I just kind of put in here, as a parent, educator, therapist, if you're concerned, always follow your instinct and start that referral process. So the premise of this presentation started with thinking of, kind of early intervention, private practice world. But then as I was working more on the research side of things and really doing the presentation, I realized, okay, no, this is more appropriate for any of our children that we are starting to introduce AAC to, right? Because we know that this all too often happens where we have students that come into the schools and they have not had any kind of outside therapy. They've not been in an early intervention program before they were 3. They've not been in any kind of intervention program with the schools prior to now. And we could talk about examples for forever, right? One example I can think of right now is, a friend who was homeschooled for the first 2 years, and now he is considered a first grader, and we have not had any outside therapy services. And so he's still appropriate for this specific topic where we're just starting those interventions. We're just starting the early introduction of AAC and language for him. So just that language therapy, if you will. So I just want to kind of talk about that in terms of this is not just looking at your, 18-month child who's not talking, or your 2-year-old that's not talking, or, not able to communicate with you. They're really struggling. We're seeing behaviors. This is also applicable to your students in the schools. Okay. And this just kind of goes into some of those early intervention models that we use. So coaching is certainly one you hear all about in early intervention, specifically that birth to 3 population. It is gaining more attention as a whole for the pediatric population, not stopping at just age 3, which I really love because I think the coaching model can be very, very beneficial. I'm actually using it with a few of my students. I do a hybrid model for my students where I'm in person and I'm virtual. So doing virtual therapy with AAC users has been interesting. But like I said, we've been using the coaching model for some of our sessions, and that has also been really beneficial because it not only is increasing the use of our students, but I'm also seeing an increase in comprehension and confidence from my teachers and my paras. Likewise, you see the same thing from your parents. So if you are sitting there and you are providing this information and these interventions to your children, and your parents or your teachers are right there with you, they see what you're doing, they're actively engaged, then they're more likely to turn around and use those different tools and tactics when they get to the home setting, right? So of course, the coaching model also then gives them the opportunity to do it while you're there and you're coaching them through providing those same interventions. So just like you would with a child, you're going to model what it is that you want them to do. Then they're going to have the opportunity to do it. And you're going to be kind of coaching them through that. You're not going to be working the child or student, you're going to be coaching the parent more so based on what it is that the child is doing. So then, of course, the family-centered practice, and this is, again, very common in our early intervention. We want everything to be that family-centered approach. We want to make sure that we are including, we're very culturally sensitive. We make sure that we are using appropriate interventions based off of their preferences. So I talk about this a lot where, you know, as SLPs, when we're making our goals, a lot of times as we're evaluating, we're already kind of coming up with goals and ideas of what we want to work on with those students or with those children. But I think we find ourselves doing that without also incorporating our parents or our teachers. And that's, you know, essentially doing a disservice because if it's not motivating or relevant to them, then we're looking at that likelihood of carryover or participation from them, and you're probably not going to get as much. Whereas if you incorporate them into this, they're going to feel valued, they're going to feel empowered, they're going to feel involved, right? And if we're using that in conjunction with like a coaching model and the modeling and different things like that, again, we're going to see their confidence increase, and then we're going to see the likelihood of carryover and those interventions happening in the home setting, which is great. School setting too. This is where I always love to throw out this statistic. And I know if you've listened to any of my presentations or if you've listened to various podcasts, not even that I've done, but I've heard this on different podcasts. The statistic of if a child only receives speech therapy interventions with an AAC device for 2 times a week for 30 minutes, and that's all they get, they would not be considered an effective communicator until they are 84 years old. And I like to share that little tidbit of knowledge with my parents and my teachers too, because sometimes that's all it takes is them hearing that to kind of be like, oh my goodness. And, you know, I need to be doing this too. And it kind of just carries over because again, they want their children and their students to be effective communicators because not only do they want to be able to engage on a different level with them, but they also need that to be able to, you know, complete basic daily activities to a certain degree. So, okay, then we're looking at expansion and modeling. So of course, expansion, we all know what that is, where we're quite literally expanding their word, their phrase. So when they're young, if they say dog, we're talking excuse me, we're talking about, yes, that's a big black dog. And then you're modeling kind of similar, right? We're modeling what we want them to say. But we're also, we're giving them this model without expecting them to turn around and reproduce it. We are strictly modeling what we want to see potentially from them, or what we would love to be, you know, kind of targeting in this, whatever our specific speech target might be in that moment. And then we have, of course, the focus stimulation, your parallel talk, milieu training, teaching. The pre-linguistic starts at that early intervention age, so that birth to 3 range, and then it transitions into the milieu training or enhanced milieu training. And we know that that's where you have your model, your manned model, your indirect teaching, or your, goodness gracious, I lost the 4th one. I'm so sorry, y'all. out of my brain. But that's another intervention that we see a lot, recasting, and then of course AAC. There's many more than that, but I just kind of wanted to touch on those just quickly as we go. The next part is kind of looking at, when do I introduce AAC? How? I can't tell you how many times I get this question. And if you're a young speech therapist, or you don't have a lot of students with AAC on your caseload, or they come to you with AAC, you're not really sure what to do, you know, this is kind of important. So I just have to say, there is no hard and fast rule. There's no checklist, if you will, as far as when to introduce, how to introduce. There's been like a lot of back and forth where people used to believe that you had to introduce some sort of low-tech AAC before you could go to a speech generating device with robust AAC vocabulary. That is absolutely not true. Do you want to make sure that the child has some sort of receptive language abilities and skills to be able to have access to a robust vocabulary on a speech generating device? Absolutely. But this is where, as an SLP, we get to do one of the best parts of our job and use our clinical judgment, right? I know as an early speech therapist, and even early, not when I was early speech therapist, but when I was just really getting into AAC, I would have loved to have that, like a roadmap of somebody to tell me exactly what to do, how to do it, when to do it. Like, okay, we met this goal, now we can start introducing this. Or we, you know, now my child is pointing to pictures on my picture board, my core word board, and now I'm ready to increase the number of words, or I'm ready to go to, you know, a speech generating device. But those don't exist. And a lot of it is because many of our AAC users are vastly different. So we can't standardize something for them, because they all develop language differently and they acquire language differently. Their use of language is different. And so you really get to use that clinical judgment, which again is one of my favorite parts of being an SLP. So one of my big things also that I share predominantly with parents, because early intervention, if you work in early intervention or private practice, I know you've heard it plenty of times before. But when you start talking about AAC with families, if they don't know what it is, they're not familiar with it, even if they are familiar with it, a lot of times you'll get kind of a pushback or the question of, you know, well, what about spoken communication? What about spoken words? I just want to hear them say, I love you. I'm like, well, what if I told you that I could get them to tell you I love you, maybe just in a different way? So also, what if we start with this device, we give them some of that functional communication, we give them a tool, a resource, a way to communicate with us, and then we start to see these spoken words come from that building of language. So just because we're using an AAC device, that's still communication, as we all know. but also the research is showing that it does foster the increase and that verbal spoken communication output. So is that across the board? Is it going to happen in every single child? No, not necessarily. But the research does show that it is supporting that communication. It is supporting the expressive language. And again, expressive language is still appropriate with an AAC device. So, and I put as soon as you identify the need. So that's another one where a lot of times I feel like therapists kind of get stuck in, well, we need to make sure that they can do XYZ first, or, well, let me try however many sessions and then we'll introduce it. So the way that I kind of think about this in my brain, or that I have presented it to people before when we're thinking about that, if you are providing articulation therapy, right? You're working with a child on various articulation errors, and you use a specific approach. If it's not successful within the first 1, 2, 3 sessions, however long you give yourself, you're probably not going to continue with the same model, right? You're going to try a different intervention, or you're going to add different prompts or different parts to that intervention. You may use a modified version of an intervention or something, but you're not going to continue to do the same thing over and over with no results. You're going to try something different. And it's the same way with these students and these children. Is we are not going to continue to expect different results from them if we're doing the same thing over and over. And so again, as soon as you identify that need, as soon as you see that they are struggling to communicate, they are presenting with some of those behaviors, they are getting frustrated, their parents are frustrated, their teachers are frustrated, whatever it might be, let's give it a try. Because at the end of the day, the only time that it's going to hurt a child to try AAC is if you don't try it, right? Because at that point, we're limiting their communication skills, because we haven't even tried it. And that AAC opens up a whole nother area of communication opportunities for our children. So then I just kind of put in here some tips, what I would start with. Again, this is not like the end all be all. Always do your own research. Yes, I specialize in AAC, but I am not perfect. I am not an expert. There are many people out there that are fantastic. I'll share some of my inspirations with you in a little while. But it takes time. Also, those of you that are younger clinicians or don't have as many AAC users on your caseload, I just have to say, like, when I started out, I had no idea what I was doing, because when I was in graduate school, we didn't even have an AAC course, period. So all of my knowledge from AAC has come from continuing education courses and actual clinical experience, right? So there's been plenty of trial and error for me too. And I have grown a lot as a clinician. Even things that I did 2 years ago, I don't necessarily do anymore. Just following a lot of like the neurodiverse affirming practices and really looking at the child as a whole. Just different things. Again, you'll evolve as a clinician. Those of you that are experienced clinicians, because I know there's a lot of you that posted that on the poll, I'm sure that you have gone through the same process that I have, where you are certainly evolving. You're changing some of those practices that you may have been using for many years, whether it be because they are, they're not as appropriate anymore, or because we know more now. We have more information, and then just how best to serve our children, right? So with our young kids, actually, before we talk about that, I also wanted to say something that I am also very passionate about is making sure that, again, we are treating the child, the whole child. We're not just, yes, we're SLPs. Yes, we're working on communication. But if we have a child that comes in and they are just completely dysregulated, how effective do you think your session is going to be? If you're an experienced clinician and you've been doing this for years, you already know the answer to that question. If you're a younger clinician, you may still kind of be thinking, oh, I don't really know. I could try to bribe them. I could try to give them incentives, whatever it might be. But if you have a dysregulated child, they are not prepared to learn, whether it be in a classroom, a speech session, an individual session, or even at their home. Like if we're all the way down at early intervention, if something else is going on, then you have to start there. So, and this we'll talk about child-led therapy in a little bit, but you have to start there, and you have to make sure that your children are ready, that they are, they're in it with you. So just kind of my 2 cents on that. But when we're looking at young children, so something that we use a lot is like a visual schedule for each session. Having like multiple short activities prepped for a session, having those visuals. I included like a visual schedule I had made for a friend down here. Obviously, she loved mermaids. And so just kind of including that. This was for her day. And as she did the different tasks, she would take them off her daily schedule. And this was on her desk. So this was in addition to the daily schedule that's posted in her classroom. I've also used this in early intervention, private practice world, where I would make the schedule just based on whatever session it is that we're doing, with the different activities included. And I also would make them for home, because a lot of times we know that our children often struggle with transitions, or if there is something different about their schedule. So I like giving the parents options where they have multiple things that they can put on their schedule. So if, on Saturday, they're not going to have, I don't know, they're not going to have like playtime at a certain time. They're going on an outing. They're going somewhere fun or doing something fun. That would be a time where they could put, outing on the schedule. And again, it just kind of helps prepare our kiddos. And it definitely helps because then they are a little bit more prepared when that transition happens and they're not doing the exact same thing. So, let's see. And then I like to talking about core words. If you are familiar with AAC, you're familiar with core words and the research behind why we implement the use of core words. We use them more than any of the fringe vocabulary words throughout a regular day. And they make up, 80% of our vocabulary, if not more. And so targeting those core words rather than targeting the word ball or bubbles. Not that that's not important to that child, but we can also facilitate them requesting that same object through the use of the word want or more or like, or, things like that. Those words that they may be able to use more often or use across various settings rather than that fringe vocabulary word that they can only use for that specific item or object. Again, including the family, this is super important because you want the family to be well-versed in what you're doing. And when you include them from the start, you kind of get that buy-in and they get to see the progress from the get-go, and they get to watch as their child gains new skills and new communication, new words, things like that. And another one that I hear a lot is that you shouldn't introduce a robust AAC system to young children. That's absolutely not true. There is no hard and fast rule in terms of when you should introduce the robust AAC, or how. That's another one that a lot of people think, oh, well, I'm looking at, 60 icons. That's way too many. It's visually overstimulating for the child. Well, okay, but instead of making their grid size smaller and taking away the even potential for communication for various communication attempts, give them that opportunity, give them the chance. Then if we see that, okay, it really is too many and we do need to adjust the grid size, then that's something you can explore. The other nice part is you can always hide buttons and bring them back. We just caution you on doing that because you don't want to hide too many and limit their communication attempts or communication abilities, right? So just kind of all the things to pay attention to. And again, it all depends on your child. So there's not, like I said, there's no hard and fast rule. There's no, you can only do this with this child, or you can only do this with this child. It's not that way. It all is very based on your individual client. So then when we're looking at our school age children, this is where you're still going to have those visual schedules. We see first then boards a lot in the schools. Something, and we'll talk about this in a little bit, but something I just want to touch on is that you shouldn't be using a first then board as a compliance-based activity. It should, again, more so be that visual representation for the student of, okay, first we're going to do this, then we get to do this. Not necessarily that compliance-based or that reward. Now, if that's what works for your student and they want to work for a star, or they want to work for, the sensory room, or they want to work for bubbles, that's okay. And having that visual representation is okay. But, looking at that compliance space, you have to kind of factor in what your first is going to be. So what your expectation is of them in that first box. Because if you have something that's unattainable, if they can't do what's in that first box, then it's not fair of us to withhold the then, right? We kind of talked about core word boards, but this is something starting with, those low tech core word boards, those picture boards. And then of course the robust AAC systems still with your school age children, including those teachers and family. That is a huge part of it, because if your teachers are carrying it over throughout the day and they're integrating communication into their classroom, then again, we're going to see a lot of positive changes much faster than if they're only getting it in their speech sessions. Okay. This just kind of goes into super brief, super quick overview of the assessment and selection portion. So I kind of listed just a few assessments there. Again, there are others. A lot of times I feel like you'll see still in early intervention, even private practice, the insurance company wants some sort of standardized assessment. And so you've got to give them something, right? And so a lot of times people will still use the PLS-5 and different measures, even in the school system. And that's okay. There's nothing wrong with that. But these can serve as those supplemental. So the AAC Genie, this is something that is used, it's on a tablet, and it helps you identify receptively what they understand, being able to identify objects and pictures, being able to discriminate those objects and pictures. How many can they, if they have a field of 4, can they still identify the correct one from the field of 4? And then of course increases in size. And then it turns around and it's looking more at the expressive side as well. Communication matrix and the functional communication profile. I like both of those because they are more of the questionnaire based. So you can incorporate your family, your teachers into answering those questions with you. And it looks at different aspects of their communication skills. And then it will turn around and give you kind of the breakdown of what we're seeing in receptive, expressive, their ability to even their sensory needs, things like that. The DAG-3 is great to use as a tracker tool and then help with developing goals. That's one of my favorite things to use when I'm writing my goals, because I'm looking at, okay, is my child, what level are we at and what's most appropriate for where we want to go. And that really outlines it quite well for you. And it is very detailed as well. And then the mosaic and the fiats, those are two others that you'll see. I feel like I personally haven't used those as much. I do have the fiats, but I've only used it a couple times personally. And then when we're looking at selection, again, there is no hard and fast rule, right? So we have low tech versus high tech, using those different assessment guides to kind of help guide your choice in the AAC model. And then pulling these different navigation uses for your kids. So if we're looking at like our high tech options, looking at that motor planning option, that motor memory, is that what's most beneficial? Or do we need to go more of that linguistic base where it's relying heavy on the syntax and the semantics? Looking activity-based navigation, is this something where that's where their motivation comes from? That's what makes the most sense to your child. Pragmatic base, does it make more sense for them to use that social piece? And is the social aspect of your communication device, is that easily accessible to your student? So all of those things are important to consider when you're making that selection. And then we kind of go into our implementation strategies. I'm just checking my time. So these are some of the different intervention models that you see implemented with the use of AAC as a whole. So facilitated communication is actually no longer recommended as an evidence-based practice by ASHA. But let's see, I want to say 4 different ones of these, that I kind of picked out. I don't want to say, I mean, they are some of my very favorites, but they, again, paired with the research, are very beneficial to our communication partners that are just starting out, or they're still learning a lot of those skills. And so we'll kind of get into those. But of course, you have your behavior treatment, environment modification, airless learning, your functional communication training, milieu, multimodal communication, naturalistic instruction, your partner instruction, peer-mediated intervention, PECs, and then video modeling. So video modeling is one I feel like research it's becoming more of a hot topic lately. And but it is, the research is there to show that benefit, especially with our students that are on the spectrum, or our children that are on the spectrum. A lot of times you can show them a video of what it is that you're wanting them to do, or what it is that you're targeting, and their comprehension of that video is often much higher than you just giving them the instruction, or telling them what to do, even you showing them what to do. So that's definitely an interesting one. So modeling is a huge one in the field of AAC, right? We often forget this, and I think that sometimes, even as therapists, we have this expectation that, okay, we've given you this device and now we're ready. You're ready to communicate. Let's go. But that would be the same as, you giving me a computer and telling me to make a video game. I would not know where to start. I so it's the same kind of thing with our kids. When we put these things in front of them, we can't expect them to just know what to do with them, right? That it's that innate understanding or comprehension of how to use it, how to execute the device, or even the pictures, that's not an innate characteristic. So it is something that has to be taught. And one of the best ways to teach it is through modeling. So whether that be that you as the communication partner have your own device or communication board, or if you're using theirs, either one. And sometimes you do a mix, right? So some kids don't want you touching their device. They don't want you to that's their device. They have ownership of it, which is great. And so you would have your own, you can model on your own. Likewise, you can model on theirs if they're okay with it. So this just kind of talks about where, of course, we're modeling without any requirement from the communication or any kind of communication from the user, or we're modeling as prompts because we're trying to elicit that specific communication behavior from the child, or we're modeling as an instruction when we're demonstrating whatever target we might be targeting for that session or with our child, with our user. So when we're looking at that, again, this can be something where I'm going to give an example of when we're playing with a young child, right? We're modeling that we want them to, we're saying go for the car. We're saying go and we make it go. We're not expecting them. We're not turning around and saying, okay, now your turn. Now you say it. We are just modeling. And we're also likewise giving that verbal prompt at the same time that we're doing the modeling on the device or on the low tech on your pictures, whatever it might be. And you're giving that model and then you're making the car go. And you may do it 10 times and they may never actually give you a response. But when they come back in the next time, you might go to that same thing and you model it once and then all of a sudden they press it. So again, when they see you do it and they make that connection between, okay, this is actually meaningful communication. When I press this button or when I say this is what happens. And they're making those connections, which is huge. And then when we're looking at kind of getting that specific behavior or prompting to get a behavior. So if we are, and I mean, this could be something as simple as saying hi and bye, right? We're targeting greetings and farewells. So I'm going to go and I'm going to say hi on their device and wave to them and also, speak the word. And I might say it a couple times, or I might just say it once and then we go on about our session and we start doing something else. Again, just modeling. And then looking at the instruction, like we said, that kind of ties in. You can tie it in with the video modeling, but it's very similar where you're going to give those instructions of like, okay, this is what we're going to do. And then I just wanted to say in here too, like modeling doesn't only have to target that communication piece, right? Like I said, we can use it for social skills, looking at that pragmatics, that play skills, pre-academic or academic skills. There's a ton of research on literacy and AAC users, gaining that joint attention, that looking back and forth. That doesn't always have to be done through play or through certain things. And that's one too, I feel like a common misconception, and this was something that was previously taught, was that, a child needed joint attention to be able to use AAC, which again is not the case. Do we want to increase their joint attention, their ability to, scan back and forth between a person and an object? Absolutely. But that's not necessarily a precursor to being able to be successful with something. And then again, with modeling, it's not commonly used independently. Most of the time you're using it in conjunction with other interventions. And this could be the expansions, your recast, prompting, cueing, using any kind of motivating or reinforcing objects or activities, giving those expectant pauses. This is one that I'm sure you can tell by how fast I'm talking, I'm terrible at, and I have to work on myself every single day, every single session when I'm working with students, kids, making sure that I give them time to respond before I provide any kind of cue or prompt or anything else. So like I said, modeling is typically used in conjunction with another intervention. But well, this is one of my biggest things, model without expectation, right? So when we are providing those models, we are not expecting anything from our child, from our communication partner, our user. We are strictly modeling for them. Now, if they turn around and they do it fantastic. That's great. That's really what we would love to happen. But we're modeling with the pure intention of showing them how to use it, how it works, where the icons are, how it is an effective form of communication. You know, the list goes on and on. The functional communication training is another intervention that is commonly used with our AAC users. And of course, it can use both low tech or high tech. This is one you hear about a lot in ABA. So we're looking at reducing those challenging or negative behaviors. We want to empower them to communicate. The biggest thing with this too is that we have to remember to accept any and all forms of communication, whether it be they're pointing to us, their body language says that they're frustrated, they are pushing their desk, you know, whatever it might be. They're giving us they're using a sign, they're pointing to something on their communication board, or they're using their device to tell us I'm mad or leave me alone, whatever it might be. So with the functional communication training, one of the biggest things that I talk about is remembering we're not looking for compliance, right? And when we're talking about reducing those challenging or negative behaviors, it's not because we're just trying to stop them, right? Rather, we want to provide our children with functional means of communication to be able to tell us, I don't like this. I don't want to do this. I'm frustrated. I'm upset. I'm tired. You know, I don't like you today, because you might get that. So just all of those things. We want them to understand that communication doesn't only exist in those happy and perfect moments or in those play moments. It exists across communication opportunities, right? So, I mean, as a typically developing neurotypical adult, I'm not happy all day, every day, right? I'm able to tell my husband if I'm frustrated or why I'm frustrated. Or sometimes I might just go to my room and I need a minute, and he knows that that means that I just need a minute, right? Because he read my body language and that was a form of communication. It's the same thing for our students that are non-speaking. We want to empower them to be able to use those communication skills. So again, we're not looking at that compliance where we're only using communication or the functional communication training as a tool to get them to do what we want them to do. It's to, again, empower them to use that communication to tell us how they're feeling in the moment and work on reducing those behaviors so they can, again, looking at increasing that communication and thus hopefully decreasing those negative behaviors because they were able to tell us before the behavior escalated so much so that we were seeing some of those outbursts or those true negative challenging behaviors. Okay. My next slide, same thing here. Compliance does not equal engagement. So just because your child is sitting there and they're doing their work, they're doing what you expect them to do because they're getting a reward when they do it, that doesn't mean that they're engaged in the session. That doesn't mean that they are actively succeeding in terms of gaining communication skills, right? In their mind, they might just be checking a box. I'm doing what Dr. Brown wants me to do. I'm doing what Miss Brown wants me to do. And I get to, I get 2 minutes of playtime after this, or I get to get that slinky when I'm done, whatever it might be. So talking about the engagement in a session with their communication partner, that's vital to the success of any communication attempt, right? So having that engagement, that's where you got to start. Like we talked about in the beginning, where if you have a dysregulated child, you're not going to get very far in a session. So working on that engagement, building that rapport, building that relationship. I feel like this is where a lot of times you see the breakdown happen, where even as parents or caregivers, teachers, therapists, you don't take the time to build that relationship with the child, and then you turn around and have these expectations for them. Well, we need to create that like nurturing environment before anything is going to happen, right? We need to have that positive relationship, that positive engagement. And that's also going to increase our children's intrinsic motivation. If we are just expecting compliance, they're not going to have that motivation to communicate with us because, again, they're checking that box. They're doing what we want them to do. And then when we leave, they're done. They don't have to deal with us until we come back and we, the next day or whenever. So we're still not going to see that same level of engagement. And then you're probably not going to see a lot of that independent use with any of their AAC devices because, again, you're expecting compliance rather than targeting that engagement. Okay. Okay, so naturalistic instruction. Of course, this is easier to do in early intervention, of course, because you're looking at, kind of being in their settings, right? Their home. But it can be used across different settings. It doesn't just have to be in the home setting. I think that's what a lot of people think of. They think of naturalistic instruction as being only in the early intervention and being provided in the home, but this can be across the board. So, school, that's a naturalistic instruction environment for them because they go to school 5 days a week for however many hours. Community, there may be different places that they go in their community regularly that's a naturalistic environment for them, and that's a perfect place for you to provide those interventions, or for the parent to provide those interventions, or the teacher, whoever it might be. And so this is where you're kind of including their different routines, their activities, those social interactions, things that happen regularly throughout their day. So this is where this is a great opportunity to use and teach those core vocabulary words, because again, we're using those core vocabulary words multiple times in a single day. And like I said, you can target in that home environment. This is a great way to engage and interact with your parents, but also to use some of the parents' goals and their wants for the child within the home. So, if they tell you that, okay, we have a really difficult time with them telling me what they want to eat, or them transitioning to go pick up their brother and sister from school, different things like that, and targeting what's important to the parent in the home environment. Likewise, if you are in a school setting, using that push-in model and being able to implement the use of AAC throughout the day, throughout a lesson, activity in the classroom, the teachers then see that, oh, okay, this can be done. I can do this. It doesn't just have to be with the SLP, because we're integrating whatever it is communication-wise that we're doing with the lesson that they're already providing, right? And then again, best part about this, it's that natural context. So we're not necessarily asking our kids to do something totally out of sorts or totally off their norm, their routine. It's normal. They do this stuff every single day. We're just incorporating the use of a functional communication tool for them into those typical settings or those typical events. It is predominantly child-led. With kind of you might incidentally create some of those opportunities, and incorporate, of course, you're going to incorporate some of those different language intervention strategies. So this is an environment where you may be using this model, but you're also using modeling. Like, that's appropriate. And we know as SLPs, we are all the time using multiple interventions, not just a single model or method. So okay. And this just kind of goes into child-led therapy. This is super important for your young ones, especially because, again, you're seeing that increased engagement from them. If they're getting to pick what the activity is, or what what time you're doing something. And again, it's helping foster and build those relationships between you and the children, forming those connections and really, really fostering that intrinsic motivation. There's so much about the lack of intrinsic motivation and seeing that device abandonment or just kind of dwindling of the use is something, unfortunately, that we see a lot. So my favorite part is child-led therapy it's fun. It really is. I will say something that I hear a lot, especially from the school side, is, well, how can I do that and still be targeting their goals, their IEP goals, or how can I do that and still be working on academics? And I mean, of course, that one's a little kind of twofold, right? Because you can always have child-led therapy in a sense, because at the same time of doing a child-led therapy, you can still provide those opportunities for incidental teaching where you're targeting certain things. So let's say, for example, we need to, we're trying to work on letters. Well, that doesn't have to be them sitting at a table matching letters to a file folder activity, or matching letters in a picture book, or watching a video on the screen. That could be you running around the room trying to find the Post-it notes that have an A, or the Post-it notes that have a B, and who can find the most A's the fastest. I mean, you get creative. So again, it's still child-led in that it can be fun and they still have more control, but you're also creating those specific environments and those specific tasks or activities. The last one that I highlight on here is the multimodal communication. So we've been talking about this across the board, right? Multimodal. We're looking at spoken communication, sign communication, SGD. We're looking at pictures, visuals. It doesn't matter, whatever form of communication they're using. Also, if you have a child who is predominantly a device user, but they give you a signed response or they give you a spoken response, that's perfectly fine and that's appropriate, and you accept that form of communication. And if you choose to, you could model it on their device, where that might be. But you're not going to ask them a question, they give you a response, and then turn around and make them tell you on their device, right? Because that's the same thing as you asking me a question, I tell you yes or no, and then you make me sign it, Well, eventually I'm going to get kind of tired of that because I'm telling you the same thing in just two different ways. So, definitely key to building that confidence with our children with these speech and language difficulties, because they see that it doesn't matter how they communicate, it's that they communicate, right? We're trying to empower them to be functional communicators. Okay, and then this is just my fun one. Of all forms of communication are communication. And as their communication partners, we need to make sure that we're honoring all of those communication attempts. So just like we said, whatever it might be, whichever way they choose to tell us or answer that question or label that object, we need to honor that. Okay. What? All right. Then we get into our parent and teacher education and engagement. So we've kind of talked about this throughout. I did plan for a little bit of time for it, but we really have kind of integrated it throughout the session. So I'm not going to spend a ton of time. I do want to talk about the implementation plans. This is something that I feel like you see used more so with your students that have speech generating devices, but it can be used across the board. It doesn't have to just be, a computer-based system. But the best part of this is that it includes or can include everybody that's a part of the child's team. So if you have a child that's in the schools, but you're their outside speech therapist, you can also include their speech therapist at school, their teachers at school, their paras. And basically it just kind of runs down, of course, what system the child is using, what form of AAC the child is using. But then also it kind of talks about goals, right? Talks about what we're wanting to get out of this, the use of this device, or what do we want to increase? And this is where you can break it down too by, home, clinic, school, and talk about, what's most important at different places. And then how can you as a team work together to make this happen? And it's a running document where, again, if you make a change to the implementation plan, then that way it will show up and everybody knows that there was a change of some sort. And then making sure I put functional and accessible, because you have to make sure that whatever form of AAC that you're using with your child is also functional and accessible for the adult or caregiver or teacher. Not that that means that if you have a child who needs a speech generating device and the teacher doesn't know the program that you're introducing, or they're not familiar with it, that doesn't mean that you don't do it. That just means that, of course, you're going to take some extra time to do some coaching. You're going to incorporate them in the session, but you want it to be functional to them. So that kind of ties in with everything else that we've been talking about, where if you incorporate them into the goal planning and development, then they're going to feel valued. They're going to feel empowered. They're going to want to do more with it. But also kind of sitting down with them and explaining how this works, what you want them to target. And something I like to do is give my parents or teachers just like one single thing, depending on the parent or teacher. If they can handle more, then we'll do more. But give them one piece of homework or activity or something to target for the week. And then when you come back, talk about those things, right? So don't just say, okay, I want you to do this. And then when they come back in, you say, so how did it go? And that's it. No, like ask some of those explicit questions about, well, what worked, what didn't work? How can we adjust this? How can we make it more, suitable to whatever? And using it that way. That's what I mean by functional and accessible. And these are just some different activities that I wanted to talk about just as quick examples. So for like your core vocabulary, and this again can be used across the board. I used the look and see with a board book activity with some of my middle school students last week, actually. So it doesn't, like, these aren't necessarily just for your young students, or kids, it can be any age. So we were using the words look and see, those core vocabulary words, and they each had a board book, and we were again using, okay, let's look for the animal. And they would tell me, look, and then I would ask the animal, or I would point to an animal, or, I would prompt or model in their device what animal I wanted them to look for. Or I would say, I see, and talk about the animal that I see. Again, all while modeling this and showing this on their device. Targeting that like or not like, this can be used for so many different things. So I just use the example of like different foods. So this is a super easy way. Do you like that food? Do you not like that food? Sensory items. We did like a theme in the month of January with one of my groups where we did all of the different senses. And so we talked about like and not like a lot, because we were trying different things. We were smelling different things, touching different things, looking at different things, and talking about, did we like that or we not? So using that, modeling that in their device, of course, more finished. These are, again, super easy ways to use that core vocabulary, but building up that confidence and building up that use with your children. The social side, of course, we are always wanting to target social in some capacity, whether it be using those greetings and farewells, being able to engage with a communication partner. All of that also depends on their communication abilities and their levels, right? So something that I put in here as an example would be like targeting feelings with identifying different facial expressions. I've used different like emojis. We have also, of course, there are different like picture cards that you can use, different videos you can watch. But one of my favorites is the next one, having a play and acting out different emotions. This has been comical, especially if you have multiple kids that you can do it with at once, because you give them each an emotion and they have to act it out. And then the other students will try to guess what that emotion is. And then, take that as an opportunity to talk about, well, why might we feel mad? What are some things that make us mad, and kind of using that to go off of. Social hour doesn't have to be an hour, right? But just taking that time in the morning to ask, like, how are you feeling today? How did you sleep last night? What do you want to do today? What are you looking forward to? Just again, to expose them to the different social aspects of communication, showing them where those different things are on their devices. And then again, how to use them. When it's appropriate to say, how are you? Or I don't like that, things like that. And then of course, the academic side of things. So you can incorporate it. Calendar time is probably one of the most easiest times to do it. So if I have a teacher who's still like kind of on the fence about it, that's usually where I start, because it's really easy to navigate on how to talk about the days of the week, the months of the year, the seasons, things like that. Talk about the weather. All of that is usually pretty easy to do with a device and easy to navigate. So if they're just starting out, that's an easy place to start. And then of course you can use it, math, literacy, different concepts. So talking about, and this is a great way to build their use of the descriptor words in their device. So being able to go and talk about the difference between like same and different, or big and little, on and off, so all of those different concepts. Okay. And then I just put on here, which we kind of talked about in the beginning, what if my child or student is a Gestalt language processor? And I did say I would save it for another day. But a few of my favorites when it comes to Gestalt is the meaningful speech, connection, speech pathology, and then Emily Diaz. So all meaningful speech and Emily Diaz, they both have active websites alongside their social media platforms. But they are all really wonderful in their advocacy, but they also have different trainings that they share, courses that they have. So those are some great resources. And then now we are up to questions.
Are you able to see that Q&A box?
Yes.
Okay.
Let's see. Let me get back. I don't know how far I need to go. Somebody had asked what a pod book was, and so that's just a dynamic display book. So looking at the different contrast, it can be very beneficial for any of your children that might have visual impairments. They might need some of that different background, if you will. Pod books, I'll be the first to tell you that is not my forte. I'm not extremely well versed in it. But they're definitely out there, and I just personally haven't had a ton of vision students. But it can be used for other students as well. Let's see. Oh, I think I am not on the Q&A. Here we go. Ha. All right. Some suggestions. Oh, sorry. What are some suggestions to transition from play-based AAC therapy to academic work when student has difficulty with attention and motivation with tasks that are not child-directed? And that's when I feel like we get a lot. So this is where you kind of have to incorporate different things that are motivating to the student, right? So like we just talked about, incorporating some things that are going to be fun activities rather than expecting them to sit down and do specific academic work. Now you can always work with the goal of getting to that point. Another one that I feel like we see a lot of in the schools are like discrete trial trainings. And this is where, you know, they're completing XYZ, they're getting their check mark, they're working for, like, they're getting their stars and they're working towards something. And that's okay. There's nothing wrong with doing that. You just want to make sure, again, that you're still building that good relationship with them. So when we're looking at trying to transition, I still would try to incorporate some of the academics into some of the play-based, if that makes sense. So when, you know, when we're doing play-based or child-led, you can still gear that child-led scenario. And also like play-based versus child-led is kind of different, right? So we still, in like just true play-based, we may be leading the session, whereas child-led or child-directed, they are the ones who are leading the session. So once you get, and I feel like that's kind of that transition, is to go from the child-led into more of a play-based into some of that academic. And you also kind of have to base it off of what they're ready for, what they're prepared for. So again, as a whole, there's not that clean cut answer that you're probably looking for. But I would start with trying to incorporate some of those academic activities into the different activities that you're doing in the play-based format. So Morgan said, any recommendations for dealing with a child who is repeating words and sounds incessantly on an AAC device? Doesn't appear to be related to stimming. So this is something that I have seen a lot of research on, talking about when you're seeing those repetitions and you're seeing what seems to be the repetition. It's not, to them, it may or may not be stimming, but a lot of times those are your Gestalt language processors. And so I will say I don't feel well versed enough to tell you exactly how to go about that. I have some who, you know, the recommendation for many years was to redirect or to tell them, you know, don't do that. But now what we're hearing more and more of is, don't tell them not to do that. Don't redirect them. Try to find out what it is they're trying to tell you, because most of the time, especially with our Gestalt language processors, even if whatever word or phrase they're using may not mean anything to us, it has significant meaning to them. And this may mean that you have to, you know, you have to get involved with the parents, asking like, what are they interested in? What are some shows that we're watching a lot of? You know, different things like that. And trial and error of figuring out why it is that they're repeating that specific word, what it is that they might be meaning to say or trying to say. And again, I feel like a lot of it starts out as guessing, and that's okay too. There's nothing wrong with that. But you'll see that light bulb go off in that like aha moment for the kid when you finally guess what it is they're trying to say. So I would start there, but more than likely it's because they're a Gestalt language processor. Let's see. More examples about the implementation plan content and what it looks like to share it and keep it updated with the team. So you can make your own implementation plan. We have our own through DTA, through Dynamic Therapy Associates, that we've developed, and we use it within our company. But, you know, we have on there specifically what their device is, any passwords that they might need. So that way, like if somebody needs to get in and change something and there's a password on it, you can hop on there and it's right there. Having everybody that's involved in the plan listed on there with their contact information can be helpful. And having, again, the specifics of it. So what grid size are they on? What language are we using? Basically how it's been set up. And then when you have this running log, this could be something as simple as having a running log on a Google Doc that's shared between people. And you can put in there, you know, hey, I really think we should add a button about XYZ. Or if you are the one that is doing the adding, you would say, you know, I added this button under here. And then that way you can always track and go back and see, oh, okay, this is where this button came from. Because you're not always going to have the time to, like, if I add a button and my child goes to private therapy, they're not going to have time to like call me and say, hey, why did you add this button? Or is there a time you want me to use this button? You know, but they can look at that implementation plan and see that communication. Let's see. Any advice on data collection for early AAC users? Always struggling to find the best way to convey progress when a child is in the early stages of learning a new AAC system. So that's, a good question. The DAG is a good tool. It's not explicit in terms of data collection, but it's a good tool to monitor progress and even in those early stages, and talk about how they're doing, how they're progressing. The functional, or not functional communication, communication matrix is also good at that because it breaks it down by different levels. But as far as keeping specific data, like if we're trying to look at percentages and things like that, that is tough because it varies so much. But that's where too, I generally say to keep your goals kind of broad in the sense that, you know, you're targeting communicating basic wants and needs, or you're targeting communication of basic pragmatic functions, so that it's not so specific that if they didn't say any action verbs that day, that's okay. They still use their device to communicate. They just, you know, this is what we targeted this day. And I also wouldn't recommend keeping your data collection to state like, oh, we went from having 2 words to 20 and like only counting the words, because we know it's so much more than that. So, you know, how many times in a session did they attempt to use their device? Like if you're talking about an early stage user, I would do that. Like that to me is appropriate way to keep data, because if they're attempting to communicate, even if it's not, you know, it may not be appropriate, they may not be using the right word, but they're at least attending to the device. They're at least, you know, attempting to communicate something to you. They're, you know, things like that. So I would kind of start there. I'm not sure if that totally answers your question, but that's where my brain went with it. Bradley, I would say my most frequently used and preferred evaluation tools would be the DAG3, the functional communication profile, and the communication matrix. Those are the 3 that I use the most, partially because it's what I kind of started out using and I'm familiar with, but also I like the AAC Genie, but there are some, I don't know, funky, sometimes some little hiccups in it, if you will. And I personally have not used the other 2 enough to say that those would be my favorite. Let's see. Clara, I have heard that it is inappropriate to include visual schedules on dedicated AAC devices. I'm curious on your thoughts. For example, TD Snap has built-in supports for first then and mini schedules. This would, to me, would also depend on the capabilities and the skill of your user. So if you feel like they are able to differentiate between, okay, here is where I go to, communicate with whoever, here's where I go to look at my first then, here's where I go to do my, look at my schedule, then that's totally fine to use it in that capacity. But I wouldn't say that it's inappropriate. I think it's definitely child dependent, just like everything we do. So I would say, depending on the kid, especially if they're young, I would start out with a visual that's not on the device itself. You could certainly have that as something you want to work towards and something you would like to get to. But starting out, I probably wouldn't. And that's just my personal opinion. That's not, fact or anything. So, okay, Lindsay, your question, my answer is going to be that same thing where they are likely a Gestalt language processor. And so you get to use that trial and error of trying to figure out what it is specifically that they're trying to say. Meaningful speech has a ton of good information. I just listened to a really good podcast with her too, of super basic introduction of Gestalt language processing and kind of how to build from the different pieces of it. So I would definitely recommend looking into that. She's fantastic. And all of her materials are research supported, research based. So one of my kids is degenerating because of medical conditions and has low tech AAC. What would be your recommendation for future sessions? So I have also experienced this. The biggest thing, again, to me, is that we want to make sure that these kids have access to functional communication and communication to some degree, right? So when we're looking at that, we're not so concerned with, okay, are we able to build up their ability to form a grammatically correct sentence? That's probably not going to be like our highest target at this point in their life, right? We're going to be targeting, are they able to say what they want, what they need, how they're feeling, if they like something, if they don't like something. And then also factoring in, are there medical needs or physical conditions that may require us to be staying on top of, like, access wise, because they might be using pictures right now for a low tech device and they're able to point to the pictures they want or, grab the picture they want. But with degenerating medical conditions, are they going to be losing some of those fine and gross motor skills? If so, do we need to look at, or when that happens, do we need to look at introducing like switches or different, again, just different forms of AAC. So, and sometimes you may see your involvement kind of fluctuate up and down. So you may be more on like a consult base for a month or two. If they're functional with what they have now and things are going well, you may just kind of take a step back. And then as some of those changes occur, you could come back in or serve more often to help them get back to that level or as close to that functional level as possible. Yes, Caroline talked about for the repeaters. I found that a lot of my students are actually teaching themselves the device, giving dedicated free exploration time, as well as honoring and figuring out what it might mean to them can be helpful. Having that open access, that is a great part of the implementation plan. Oh, she said communication sampling analysis tool is helpful for data collection. So that's a recommendation. But yes, giving them that time to explore their device, play on their device. That is very important because just like learning language, they're doing the same thing. So we have to, we have to remember that. And I think that's something we forget too. Let's see. Yeah. Okay. Jim, I think that's all of the questions.
All right, Kaitlin, thank you so much for your presentation today.
Absolutely.
For anyone that's still with us, if you are looking to earn ASHA CEUs for this session, you will need to complete the assessment. I'll put that link in the chat one more time just to make sure you get that. If you do lose that once we leave the session, please feel free to email ableu@ablenetinc.com and I'd be happy to provide you with that link. Thank you everyone for attending and have a great day.